Welcome to the Three Tomatoes Virtual Renewal Summit. This is our fourth summit, but the first virtual one. The event is co-hosted by Ann Akers and Cheryl Benton. You'll be inspired, informed, and motivated by our fabulous lineup of speakers and panelists. Here's to thriving in midlife and beyond. Diane DiResta interviews Dr. Richard Carlton, an integrative physician. Diane is founder and CEO of DiResta Communications, a New York City consultancy serving business leaders who deliver high-stake presentations, whether one-to-one, in front of a crowd, or from an electronic platform. Diane is the author of Knockout Presentations, How to Deliver Your Message with Power, Punch, and Pizzazz. It's an Amazon category bestseller, and she's also spoken on 4 continents.
Hello, I'm Diane DiResta. Welcome to the 2020 Virtual Renewal Health Summit. We are honored today to have a special guest, Dr. Carlton. Dr. Carlton is an integrative psychiatrist with a private practice in Manhattan, in New York City. He has over 45 years of experience in alternative and complementary approaches, working with a number of problems in psychology, with psychological disorders, as well as a number of medical problems. Although he specializes in psychiatry, he's remained well-grounded in medicine, and that's evidenced by 2 books he co-authored. The first one is nutritional approaches to type 2 diabetes, and the second one is dietary approaches to literally starving cancer. He is now writing another book, an ebook, about treatments for COVID-19. I'm going to read this title literally. It's Nutrients and Herbs That Hack COVID-19, an Indispensable Compendium. On this interview, we're going to discuss those key nutraceuticals that he recommends, their brand names, how they work, and even some of the complications. So welcome, Dr. Carlton.
Thank you, Diane. It's a real pleasure to be here.
We're glad to have you. And over the years, you have worked and helped thousands of people. And in your work as an integrative psychiatrist or physician, people are sometimes confused by that term. What exactly is an integrative physician, and how did you go down that path?
So we would rather use nutritional approaches, diet changes, nutrients, herbs, whenever possible to treat a malady and not have to rely on the prescription medications because of the dreadful side effects. Every year, tens of thousands of people are hospitalized because of the side effects of medications, prescription medications. And I'm glad that we have them available as big guns to use if the nutritional approaches don't work. But it's nice to have a choice.
It really is. You know, as we move through this challenging time of this pandemic of COVID-19, you know, there are a number of conditions that affect all of us. But what are the most common problems that you're seeing right now? And what are your recommendations for dealing with it?
Well, the biggest problem is that people are just not taking this disease seriously enough. Even though there's ample information on television about how dreadful it is, there's just a lackadaisical, casual attitude in the population so that people feel they don't have to wear a mask, they don't have to wear gloves, they don't feel they have to socially distance. And I'm seeing it every day, and I'm treating people who were not patients previously, but now they're patients. They are recovering from COVID-19. They were positive, they were hospitalized, and this is a miserable disease. And anybody who tells you that's just like the flu, a little bit worse, that's nothing like the flu. They feel during the illness like they're being stabbed with knives. They feel their back is breaking. So elephant standing on the chest, they can't breathe, they're suffocating. I'm talking about the ones who survived it. And they're sick for months afterwards. They're well enough to be discharged from the hospital. They tested negative on the nasal probe. They send them out. But I'm doing the videos with them. They're lying there like abjectly miserable, panting, in pain. It's just horrifying. And this gentleman I saw yesterday for the first time virtually, I said, weren't you wearing a mask? He says, I didn't take it seriously.
Oh, I know everybody's getting frustrated and restless. I'm still wearing my mask, but after talking to you, I'm going to be extremely careful. I think what's happening right now is people have been on quarantine for a long time and they're saying, okay, we're past this, it's time to come out. And they're lax with some of the masks and gloves and all of the recommendations.
Yeah. Before talking about the compendium and working on the nutrients, the most important thing I could do is prevention, right? If I can prevent this illness in even one person.
Mm-hmm.
So I just want to explain what's so deadly about this virus, besides its virulence, the way it attacks the body. It has the ability to propagate in the nose and the throat and not show any symptoms for a week or two or forever. Some people are just carriers like typhoid Mary. But if they're going to get sick, it's 2 or 3 weeks. So that's called, there's a term for it. I just heard this yesterday at a lecture. Transmission before symptom onset, TBSO. So it's coming out. So picture that you're in the supermarket and you're not wearing a mask because you figure you don't need to. The nice little lady in front of you is not sick. She's harboring it. There's a cloud of virus particles coming out of her moisture droplets. You know when you breathe out in a cold day, cold night, and you see the vapor?
Mm-hmm.
So she's breathing out her virus. And she moves forward to the cash register. You come into her place, you're in her cloud. 3 weeks later, you're in the hospital. How did I get it? That's how you got it.
Yeah, that's really scary. And I've heard stories where if you sneeze in an elevator, it can last 30 minutes in the elevator.
Well, a sneeze or a cough will go down to the floor in 2 or 3 minutes.
Mm-hmm.
What's more dangerous is the non-sneezing person. The person doesn't know that they're sick. So we're used to the fact that the influenza, people will get sick of the influenza within 2 days of exposure. So they're sneezing and they're coughing, they take themselves out of circulation. And if they do come into public, like to a doctor's office, you hear them sneezing and coughing, you say, please go home.
Right.
Don't come here when you're sick. This is different. You don't know. They look perfectly healthy. They're not nasty people who would come in sick to a supermarket or to a birthday party or a wedding or a ball game or wherever else they're congregating. They're nice people. They don't know. And that's the stealth advantage that this little Hitler virus has.
I know that you've referred to it as a stealth virus. And I know I got upset at one point. I was in a store, I was in a CVS, and I was at the machine to pay for my items. And the woman behind the register and another customer came out from behind, and they were like, right here. And I said, get away from me. And I know that's right. Not exactly polite to say, but I thought, are you crazy? I still do maintain that 6-foot distance.
You should. It's good.
Yeah, it's very serious. I see a lot of people forgetting that. They're taking their masks off and they're not distancing. That's the thing that I have an issue with. So it's something about that. In terms of distance, is 6 feet still the realm or the rule?
It's better than nothing, but it's really not enough, because if we're 6 feet apart and talking, my moisture droplets reach you and yours reach me. A Japanese scientist and engineer did high definition laser beams into the air, and you can see the droplets exchanging.
Wow.
So if you're going to a party,
more careful.
Wear a mask. Yeah. And you know what? One of the main things is you have to be firm and tough in your own mind and not care what people think. If they think you're stupid for wearing a mask or a chicken or a wuss, let them think it. The hospitals around here. I lost your audio.
Thanks for setting us straight on that, because that's really critical that we don't get lax at this time. You know, I know when I had spoken to you earlier and you do treatment with nutraceuticals, you had some success stories. I think one of them was with a boy, a child.
Yeah. So
Talk to us about the power of nutraceuticals, because this is what your book is about.
Yeah. So this is a 15-year-old boy. He started seeing me about 3 months ago. I tried some dietary changes, didn't make much difference, and a vitamin or two. Finally put him on a B complex. But a B complex that's activated as a coenzyme form. It's not just any B complex. The mom said in the next session that within 3 hours, he was talkative, He was communicative. He participated with the family. And then the days that followed, he volunteered in his class. Now the classes are virtual.
Mm-hmm.
He volunteered to read some passages and actively participated. And this is totally new for him. He's autistic and very Asperger's and not verbal.
Yeah. And 3 hours to have an impact, that's huge. And we're so accustomed to taking pharmaceuticals, and I'm not saying we shouldn't because they do a job for very serious chronic conditions, but I think there's an area that we know very little about, and that's nutraceuticals and what can be accomplished without as many of the side effects. There was another situation you told me about. I think it had to do with vitamin C.
Yeah, but before I talk about that vitamin C, so to understand what's the B complex doing, it sounds so dinky, doesn't it? Like, how could a B vitamin make a kid autistic start to speak? Neural connections are cemented by niacinamide and other B vitamins. B6 are indispensable for neural connectivity, dendritic attachment. So you're activating brain connectivity. And my wife gave me a wonderful saying. She didn't invent this, but she says, run it up the flagpole and see who salutes. So I offer the brain these various nutrients and see who salutes. So the vitamin C story, my wife's alumni association, there was a very nice guy who would go to the meetings. And at one point he showed up sweating on a cool day, looking very sickly. And I said, what's the matter? He had hepatitis. I think it was hepatitis B. I'm not sure at this point what it was. It wasn't my patient. I said, take vitamin C, 500 milligrams. It kills viruses. This would be a great segue to the compendium we're going to talk about. So we saw him at a party, alumni association meeting a month later. He was taking the vitamin C. He had gone back to his physician for a repeat blood test. Physician's office called him the next morning and said, come back, there's something wrong. We think we mixed up the labels, the blood tubes, because his liver enzymes came down to normal from that little bit of vitamin C. They repeated the test, and it was really normal. Then I would see him at meetings after that, and he would go off the vitamin. And I say, why? He says, well, I was doing well. But his enzymes came back up, and he was sweating and sick. And this happened 3 or 4 times. It was like a placebo-controlled trial. And finally, after the 4th time he went off them and his enzymes went up, I kept quiet. You can't make somebody do it. It's not my patient. I could, coax them like that. But think about it. This vitamin, 500 milligrams, you can get any drugstore, any pharmacy, was killing the virus and repairing the liver. Those elevated liver enzymes come right down.
Something as simple as vitamin C. Who would know?
And they're using vitamin C in large dose intravenously at a hospital right near here in Long Island, the Northwell Hospital, and on the COVID patients. And it's saving lives. Yeah.
Vitamin C.
Yep.
Who we would never have known.
Right.
That's why this book is so important, especially at this time. So give us a flavor of what's in the book. Give us the inside scoop. What are some of the nutraceuticals that you would recommend?
So I'll mention 2 of them by name to give people a flavor of what it's about. The most important of them is a mineral called selenium. And the reason this is important, selenium gives an assist, it's what we call a cofactor, for an enzyme called, ready? Glutathione peroxidase. You can abbreviate that GPX, all capital letters. That enzyme attacks viruses. What it really does, it's anti-inflammatory. The damage that viruses are going to do is largely by creating a lot of inflammation, especially this COVID virus, the SARS-2 COVID virus. The virus doesn't kill, it's the inflammation that kills. A quick aside, so this is very important. The virus especially attacks in the alveoli, where there's a receptor, an abundance of receptors. And the inflammation causes the alveoli to shed. And so the little sacs are like grape clusters, fill with serum, liquid, and you suffocate. That's the reason people are being put on ventilators. They're drowning in their own secretions. And that's because of the inflammation. So selenium activates this enzyme, glutathione peroxidase, to fend off the inflammation from the viruses. And population studies have shown that, I get goosebumps just thinking about this, people who are low in selenium levels are much more prone to contract these undeveloped viruses like influenza and coronaviruses. They'll get them. They'll get
Really?
much more sick from those viruses.
Why
Whereas
aren't we hearing this on the news?
you think you heard about it in my compendium. People people who have high levels of selenium are very resistant to contracting these viruses, and if they get them, they don't get very sick. They're the people who seem to skate in flu season. They never got it, or they just had a sniffle for one night.
Mm. So selenium's one of the ones that you recommend.
Yeah, but I want to tell you a very important story. You'll see in this health food store that the dose is always, or almost always, 200 micrograms. It's mcg, not milligrams, micrograms. Why is it 200 micrograms? Because anything more than that is toxic for many people.
Mm.
So I was taking 200 micrograms. As soon as this pandemic was announced and started, I started taking it. One day, about 2 weeks later, I was trying to take my selenium pill and I couldn't swallow it. I take a lot of vitamins and minerals, have no trouble swallowing it. If I can't get something down on the 4th or 5th attempt, I know my body is telling me something. Don't take it. So I listened. And I went upstairs to the computer and I said, I've been meaning to look up what is the actual toxicity of selenium because I knew it could be toxic. I didn't remember what the symptoms were. The symptoms are of selenium toxicity, diarrhea, and I was having little loose stools, but that can be a symptom of COVID-19. COVID-19 can present as a gastrointestinal flu, but also can produce pneumonia. I said, what? The toxicity of selenium could cause pneumonia. I'd wind up in a hospital thinking I have COVID-19. The test would come back negative. In the meantime, I'm in the hospital as a side effect. So I looked online further and found one physician says he gives 50 micrograms of selenium per day to his
Did you say
patients.
15 or 50?
50, 50, instead of
50.
200. So brand name, Solgar, I get no economic benefit from this. Solgar, S-O-L-G-A-R, makes a selenium supplement that's got 100 micrograms per tablet. So already it's half of the 200, which 200 is too close to the toxic level. You want something a little bit safer. So for myself and for all my patients and my loved ones, it's half of the 100. It breaks easily, small. So 50 micrograms a day of selenium to give yourself some guarantee, not a guarantee, some
Well, this is
fighting
important
chance
to
against the
know.
virus. Yes, it's
This is
important to
important
know.
to know because we sometimes go, I know I just go and I buy vitamins, but for something like this, you really want to be talking to a doctor, a nutritionist for the right dosage for your body. Is there anything else besides selenium that you would recommend?
One of the really important supplements to take is turmeric, which is the active ingredient in, well, it's curcumin, the active ingredient in turmeric. That's the Middle Eastern spice. It's shaped kind of like a carrot.
I like it.
Yeah, it's a wonderful spice. It is a wonderful anti-inflammatory. And why do we need an anti-inflammatory when we have COVID-19? Because that's what's going to kill. And if you don't die, it's what's going to maim and make people ill for months and months, and maybe have a heart attack a year later, or I'm sorry, a month later, or get a stroke a month later, or meningitis. Little children are dying from COVID-19 from meningitis. It's the inflammation that kills. So turmeric, curcumin, is a really potent anti-inflammatory. And so it
So
should be,
what I'm hearing from you is you want to make sure that you minimize the inflammation and that selenium and curcumin are two nutraceuticals you recommend in building your immune system in terms of the COVID-19. Anything
yes.
that we should know? Not that you're going to give away your whole book, but any other nutraceuticals that are important.
Well, I'm going to talk about zinc and I'm going to talk about elderberry. Zinc will be a thumbs up and elderberry will be a thumbs down, and I'll explain why. Excuse me for drinking.
All right, so this is an eye-opener for me, and we had this discussion. I take elderberry, not often, but if I have a cold coming on, it really works. And you told me that that's a no-no. So explain why that is not good, because it does build your immune system. So why would you not want to use that to build your immune system with COVID-19?
Logically, you'd think you'd want to build your immune system, and you do to an extent, and the selenium will help you to build it. But the way the virus kills is by generating a powerful inflammatory storm. It's called a cytokine storm. And folks, cytokines are chemicals that the white blood cells release to signal other white blood cells. I want a macrophage to come out here. I want a neutrophil to come in here. I want you to come and get rid of this thorn, that's causing an infection. Cytokines. So, and that cytokine storm will kill. At that stage, when you have the cytokine storm from COVID-19, you need things to suppress the immune system. In the hospitals right now, in the trenches, on the front lines, they're using different monoclonal antibodies, like they're using arthritis and temporal arteritis. So they're using things like that to dampen the immune system, and they seem to be working. You've got to quiet down the immune system because it's going to kill. So if you're taking elderberry, sambucus is the name of the herb, at that stage of the illness, you're ramping up the immune system, fight, just when you need to dampen it down, and it could kill.
This is so important. It's so critical because it's anti-intuitive. In other words, we're thinking, oh, let's boost our immune system. And you're saying, no, we need to suppress it when you're at a certain level.
That's right.
This is really critical. And I know I definitely will be getting that book. And I want to read the title again. I know this is a working title, but it could change, but it is called Nutrients and Herbs That Hack COVID-19, an Indispensable Compendium. Now, do you think they'll be able to get it on Amazon when it's published?
I do. That's what I'm planning for. Yes.
And
yeah.
How far out are you? When do you think it'll be published?
I think I'm going to finish writing it in about a month's time, so that'll be the end of June. It's a tough book to write. There's a lot of immunology, and I'm a psychiatrist, but there's enough that I know. And, we don't have any proof. I really want to emphasize that to people. There's no proof that these things will work. If you're wise, you're not looking for proof. There's no double-blind studies being done on these nutrients. Right. You're trying to get a fighting chance against this deadly virus. Anything you can do to get an edge. Would this be helpful
even when there wasn't a virus, if we took things like curcumin and vitamin C and zinc and all of that?
Well, I'm so glad you asked that, because one of my patients, who in the middle of March, I put her on turmeric as protection against COVID-19, she told me in the middle of April in a virtual follow-up that her arthritis of the knee is not bothering her at all anymore. And she was taking meds for many years for the knee. I didn't know that she had knee problems. She was seeing me for PTSD. And I didn't tell her that turmeric is used to treat knee problems, knee arthritis, but it's a very good anti-inflammatory. So millions of people take turmeric for knee problems.
Interesting.
But I didn't tell her. So it's not really a placebo effect.
Yeah.
So this would help. These things will boost your general health, yes.
Well, when you think about it, most of us have the ability to combat this virus in our own way, in our own terms. But what would you recommend in terms of keeping a normal life and still doing the things that will help you build your immune system apart from the nutraceuticals?
So the most important thing is prevention. Dr. Michael Greger, a very good physician who does a lot of blogs, he says the best treatment is prevention. So wear your masks and be diligent about it. Wear your gloves when you're out shopping. Why gloves? Because the first time I was putting masks and gloves on in the supermarket, I reached for the shelf and I came back like this to scratch my face. We touch our face 19 to 25 times a minute, every one of us. Mm-hmm. We're always doing that. It's just unconscious. And I saw the glove. And I went, no, you can't do it. And I had a mask on, so I wouldn't have touched the mucous membranes. But I knew to go, you need those gloves when you're shopping. Yeah. Because that nice lady who's breathing at the droplets, it's on her fingertips and she's touching the packages. And the little computer screen, you put your card in and you say, yes, I accept that amount. It's on your finger.
Mm-hmm. Yeah, we don't realize all the surfaces that we touch.
Yeah, so hygiene is really important. You need to stay well hydrated, get adequate rest. That's so important for the immune system. Good amounts of exercise, don't go crazy. But a very important thing is to do activities judiciously. A friend of mine went out in early April and did the spring cleaning on his lawn. I got terribly inflamed, pollen. I went for COVID testing. It was COVID negative, but I'm sure he lost hair on the top of his head from the 2 days he was waiting to get the results. Don't clean the attic. It's full of dust. Don't use the heavy-duty machinery. If you're not a skilled craftsman, don't say, oh, I have all this spare time. Let me go with the buzzsaw and the chainsaw. Because you don't want to wind up in the hospital. You don't want to go there.
I'm loving this tip. I'm loving this tip. I'm not going to clean anything.
Clean, but within reason. Just, you have to think through what you're going to do, because you don't want to wind up in the hospital. You don't want to be there, and they don't want to see you. They're busy.
Well, these are all important tips. I feel like you've been so informative and so educational. I know everybody's going to want to get your book when it's published, so please let us know. And what parting thoughts do you have for our listeners before we end today?
Well, two things. One is, if you're going to take nutrients, and you probably should, be open to the fact that there can be side effects. It doesn't matter if everybody else tolerates them. There can be side effects. For example, the zinc that so many people take right now, you can't. It's off the shelves in the health food stores, because zinc is a good antiviral. But it can nauseate you, can make you throw up if you take a lot of it. So if you start getting symptoms from a supplement, you might want to consider stopping taking it, because it gets really bothering you. But the zinc has to be the kind that, as a zinc lozenge, zinc citrate or zinc gluconate, that will dissolve as ionic zinc and coat the virus when it's in your throat. Other forms of zinc are worthless. They are not ionic. They won't bind to the virus. So that's one point. That's why I call my book indispensable, because you're not going to get these little gems, these little pearls elsewhere. Nobody's telling you about the zinc. And
No, I haven't heard it.
And the elderberry, that it could backfire on you. So this
Didn't know that either till I spoke with you. And so this seems like a really helpful guide.
And the other thing, the last thing is, you've got to be your own person. You've got to think for yourself. You know, when they first told people to lock down, they said, don't wear masks. It's a waste. It won't help you. That was brutal for me. I was in the supermarket looking at all this humanity not wearing masks, and I'm wearing a mask because I can figure it out. That was a health policy decision. They wanted masks available for the healthcare workers, and first responders. I understand that, but cover with something. They made it seem, for whatever their reasons, like you could just blithely go into a supermarket, and that's where people got sick. And I watched the hospitals fill up. All those nice people in my supermarket, they were in St. Francis and Northwell, filling it up. Wow. One of my patients, as a nurse with PTSD, she lost 32 patients in a rehab facility, dead from COVID-19 in 1 month.
It's just been horrible. And I'm so glad that you're sharing these tips. I'm sure they'll be helpful to everybody who watches this interview. So we want to thank you again for being here with us and enlightening us. And may everybody be safe.
Be safe. Thank you, Diane. Thanks.
Thank you.
Bye.